formación y reclutamiento de los profesionales de la salud. José Varela, aquí presente. También el director general del Instituto Mexicano del Seguro Social, el maestro Zoe Robledo Aburto. También el director de prestaciones médicas.
We also have the presence of the Director of Medical Benefits from the National Institute of Health, and we have our dear friend here with us, the coordinator of the National Wellbeing Institute, Alejandro Perez. And as commenting on what and expanding on what our president commented this morning, we're going to be talking about the training and the recruitment of the medical professionals in our country. Good evening, everyone. I'm very happy to be here. It's been 92 days now since we've been monitoring the worldwide presence of an unknown virus. This is the number 37 occasion of this conference. And just as many other things in our Mexico, is an unexpected situation that we have fortunately sustained with the objective of reaching the Mexican people and communicating with the people. We have been very grateful and we have thanked the Mexican people because of their solidarity, their presence, their humanism when facing this epidemic. But I would like to reiterate it today with great confidence that thanks to our people, our Mexican people, we will continue to move forward. Today is also a very important day because we're making a calling to all our health sector professionals, our doctors, our technicians, our nurses, and all of those who are fighting at the front line of fighting this enemy, this virus. The journey of recruitment, of health professionals recruitment, just as has been stated by the Deputy Secretary, Dr. Hugo Lopez Gatell, is a calling to all of those practitioners and medical sector professionals who want to honor that commitment that we all who work within the health sector have assumed. This is our duty, and now I would like to give the floor to our spokesperson. Thank you very much, Secretary. And now I'm gonna stand, if you allow me, to share some information about the technical report, and then we can begin the proper conference. As we always do, we'll be showing this chart in which we represent the distribution of the transmission rate of this disease in different regions of the world. As you can see, we can observe different regions as they are organized by the World Health Organization, and we can notice that the European region represents over 50% of the transmission rate. Of course, these numbers will continue to change, and we hope for the good of the people in Europe that they will have a lesser and lesser representation in this chart. But unfortunately, we are also expecting the region of the Americas to be increasingly represented in this chart because with the information we have, the number of infected cases will continue to rise. Talking specifically about Mexico, we have accumulated, unfortunately, 1,890 cases so far, and we have a condition that is similar to what happens everywhere in the world, which is most of these cases have appeared during the past 14 days, but there is a fourth of these cases that have already stopped being contagious. We also have over 9,000 that have been determined to be negative, and I would like to remind you that the cases are studied depending on the symptoms. If a person shows symptoms that are characteristic of the COVID-19, headache, cough, muscular pain, then if they exhibit these symptoms, then the health professionals health sector professionals will identify these symptoms when they go to seek medical treatment, and then they will determine that they are suspect cases, and then based on their specific conditions, they will test the patient to see whether they are infected or not with the COVID-19 virus. So this number, 1,890, are the confirmed cases so far, but out of all of these tests that we've carried out, there have been over 9,000, almost 9,500 cases that have been negative when tested. And we have 5,827 cases that are currently being studied, and we don't have a result, but all of these tomorrow will appear either on the confirmed section or on the negative section. Unfortunately, we have accumulated 69 people who have lost their life, who have died. And unfortunately, these people, all of these people who have died, they had chronic conditions, and those were the determining factors in when it comes to the virus presenting severe complications. Now we have the distribution per state in Mexico. As we can see, the Mexico Valley area is the most affected one. The areas in yellow is mainly the region of the Mexican Valley. Even though we color in yellow the whole Mexico state, but most of the cases are in the Mexico Valley area. The same thing happens with the state of Jalisco, and the same happens with Puebla. Now we can see here the distribution of cases, of number of infected cases per state in Mexico. It is not surprising that Mexico City is the one with the highest number of cases, because we also have the highest population. So that explains that we, of course, will have a higher number of infected cases, confirmed cases. Now, if we look at the following chart, we will see that the distribution varies a little bit, because, next slide please, this is the incidence rate, which means the amount of confirmed cases as compared to the per 100,000 people, so compared to the population. So here we have 5.2 cases per 100,000 people in Mexico City have been confirmed with having COVID. And so on for the different states within Mexico. You can see how Mexico State has 1.03. So Mexico State is not necessarily the highest. If we take into account this population proportion, is not the same number as if we just look at the absolute numbers. Now here we have this other data that will vary in the following days, but 43 days is the average age for the patients that have been confirmed as COVID cases. And this is important because our country, when comparing it to other countries, for example, those in Europe or Canada or the United States, the population is younger. We have, on average, 10 years less than the European countries and 7 years less than the United States when we compare half of the population, the ages of half of the population. And COVID cases have been showing a behavior when it comes to the behavior of the disease that is similar to the one that has been observed in the European region. So this doesn't necessarily mean that we will have a lower risk, but it does mean that it is less likely for people who get infected with COVID to present complications and severe symptoms because they are younger on average. But unfortunately, and we have been talking about this, and we said this a few weeks ago, but I would like to say it again today, in Mexico we have a big prevalence of diabetes. We are one of the countries with the highest amount of diabetic patients in the world. And also, when it comes to obesity, 3/4 of the Mexican population are overweight or they have some sort of obesity. This is the result of over 4 decades of poor nutrition, and it's a bad nutrition that has been caused by bad quality product, high caloric index products, and with low amount of nutrients. So we are seeing the consequences of over these 40 years of bad nutrition habits. So I would like to emphasize this. There are also other diseases that are related to these metabolic conditions. Now, in this chart, we can see the difference by age group between the patients that have been hospitalized and the patients, and they have been hospitalized because they have presented severe symptoms or complications, and the ones that haven't had the need to be hospitalized. And we can see that almost 80%, meaning 78% of cases, are actually outpatients because they present mild symptoms and they go through a natural process of recovery without having to seek more urgent medical attention. But these 22% that we are seeing here that have certain characteristics that lead to severe complications, and then it can lead to pulmonary disease that can prove lethal. Now here we can see that the amount of inpatients or patients that have been hospitalized, they tend to be on the right side of the graph of the chart, which is the senior citizens side. Here we're looking at the statistics of the current state of the patients that are currently infected with the virus. We have that almost 78% do not present any sort of severe symptoms or of complications. We have 9% that are stable, 11% that are in severe condition, and 1.3% that have been intubated. When it comes to the mortality index, it is also quite clear that there is a relation between the age of the patient and the proneness to die because of this disease. Here we have the raw statistics of fatalities that have occurred by state in Mexico, and Mexico City has had 16 deaths so far. Sinaloa has had 10, and so on and so forth. Tomorrow we will add, we didn't have enough time today, but tomorrow we will add the lethality rate, and that is an important rate because that's the percentage of people who having been infected end up dying. And this is important because just comparing the raw numbers between states, it can lead to confusion because we're not taking into account the population of each state and the specific conditions. But tomorrow we will be talking about the lethality and the mortality rates, not just the raw numbers. And I would like to put this disease into context. When we're talking about mortality, we are talking about how many people die of a specific cause, in this case COVID, as compared to how many people live within a specific territory. But lethality is how many people out of those infected by this specific disease end up losing their lives. And these two measures, mortality and lethality, are different, and tomorrow we will elaborate on the differences. Now here we can look at the comorbidity relation, meaning out of these deaths, out of these fatalities, how many patients presented severe other like chronic diseases like hypertension, obesity, diabetes, kidney failure, how many of them were smokers. Next slide, please. And last but not least, we have the epidemic curve that we look at every day. We take as reference the initial part of growth in transmission rate that presented itself in other countries like the United States. So far, the United States has been the one with the fastest increase in the transmission rate in the world. And when we were designing and then later implementing the safe distancing measures, we can see here that they they started to actually show their effects on the 23rd of March, which is, there's a mark here on the graph, and that is the inflection point. Basically, the inflection point is when we go from slow rate to fast rate when it comes to the infection rate of the transmission rate of the virus. So we've had a sustained increase. We haven't had a very fast or sharp change, but it's still early to make assumptions. In due time, we will be providing this with numeric analysis and numeric evidence, but it is good to be updating the advancement of this curve on a national level every day. And last slide, this is the accumulated case the accumulated case curve, and we also have on the bar lines the amount of new confirmed cases every day. It is important to remember that out of all of the infected patients, a lot of the cases recover, and a very few of them, unfortunately, end up losing their lives. Thank you very much. Now, Doctor, you have the floor now. Will you share with us some information about human resources that you prepared for this conference? Yes. So Mexico will have enough medical sector professionals to provide care for those patients that have been infected with COVID-19. In order to achieve this goal, we have implemented a human resources reconversion strategy that will allow us to be better prepared when dealing with this emergency situation. In this way, we can make the most out of the resources that we have available nationally and provide the specific training that will allow them to provide treatment for the coronavirus infected patients. This will also allow us to reorganize the health services in order to have a more effective impact on the mitigation of the epidemic. So the way we're going to reorganize this is we're going to appoint a chief doctor that will be in charge of a specialized team, and all of the team members will be trained specifically and provided with specific courses regarding COVID-19. In this way, a team could be formed out of a specific team could provide care for 25 patients at a time, and the same strategy is going to be implemented when it comes to nurse personnel. Now, in order to avoid unnecessary transportation and deal with the transportation needs within this pandemic, we will have a continuous training platform that is available online on our official website. The contents of this platform have been designed by a group of experts, national and international experts, and they have the following. They have reconversion. They cover topics such as hospital reconversion, critical patient treatment, ventilator handling, and this training will be complemented with a virtual forum with open mics that will be implemented from the Wellbeing National Institute headquarters every day from 5 to 7 to reach the goal that the medical professionals can have real-time interaction and then create a learning community for the better treatment of this epidemic. On top of this, the health professionals can also access the newest information and scientific literature to be better prepared for dealing with the COVID-19. If you want to join our specialized teams for treating COVID-infected patients, you can register at our official website. This is the time for doctors and nurses to serve their country. Thank you. Now, could you... Well, good evening, everyone. Today, the whole health sector officially starts the national program of recruitment for medical professionals that is named Mexico against COVID-19 versus COVID-19. We've been talking about in the past few days that we have a critical deficit when it comes to human resources in the health sector in our country. So this program is aimed at providing adequate and specialized treatment for all those patients that end up being infected by COVID-19. So in order to reach this goal, all the health institutions on a federal and local and state scale have coordinated and joint efforts in order to publish this set of requirements and make a calling to all of those doctors and nurses and general doctors, specialists, general nurses, technical nurses, anesthesiologists, pulmonologists. All of these specialists are very important to provide proper treatment to those COVID-19 patients. And the most relevant part of this calling is that all the health sector professionals will unite and will come out together, and they will join efforts to have a collective strategy against this pandemic. Now, Dr. Zoe, now you have the floor now. Thank you very much. Thank you very much, and good evening, everyone. Dr. Alcocer, Dr. Gatell, Dr. Svag, Dr. Borja. Yes, this is indeed an effort that has been extraordinary in our estimation. Because yes, all of the health sector institutions in our country are doing individual efforts to fight this pandemic, but to do it in a collective effort and to join forces, we believe that this is a great message that expresses that this is a situation that concerns us all institutions. But also, I would like to say that this recruitment program is we are hiring these professionals for a period of 6 months, and this provides advantages because this allows the institutions to provide health benefits and social security to the worker that is being hired, but also to all of his or her family. The salaries are very competitive, and something that is very important that has been mentioned by Dr. Svag is that this training is sector-based training, which means the team of specialists that will be implementing these training courses that cover a wide array of topics from personal protection but also to more specific fields. So these training courses will be implemented by the very best of the best in our country and the very best of the best of each of our country's institutions. So you will have specialists from IMSS, from ISTE, from the Ministry of Health, and this is an effort to also replicate the joint efforts of the federal government in the national strategy against COVID-19. This also provides an additional incentive, specifically for general doctors who have started to register the pre-registration process of the national exam of the medical of the national health system. So the motivation, the extra motivation to these doctors is that this could provide them with extra points, so to speak, for their national health system examination that is taking over this year, later this year. So it's they say that this examination that will take place and takes place every year and will take place later this year is one of the hardest examinations in the world and in the country. So participating in this program, of course, will have benefits to them in that regard. Now, this sector-based training that we are designing is very interesting because it has a set of characteristics. First of all, we are contemplating law benefits and adequate benefits to all of these workers, social security, um, year-end pay, paid holiday, and on top of that, we also have different extra benefits according to each collective hiring or work contract that they will be signing for a period of 6 months. And this could reflect on additional benefits for themselves and for their family. For example, life insurance, help for food stamps, so to speak, also like additional help for cultural engaging in cultural and academic activities. And in particular, in the case of the National Institute for Social Security, IMSS, we will also provide a additional benefits such as compensation in case of disease doctors. Well, this whole set of benefits is very important because we know that the practitioners that choose to participate in this program are gonna be exposed to a higher amount of risk that normal, and of course they have to be compensated appropriately for that. And of course we will be providing the sufficient and the proper equipment for personal protection for dealing with this pandemic. But I think the most important part is not only that calling to solidarity that has been expressed by Dr. Alcocer, but also it is very important to emphasize the training programs that we will be implementing. We really have specialists that are extraordinary specialists in our country that really provide even counseling for a lot of institutions, and they are the ones that are going to be leading the way when implementing these training programs. And I think this is a joint effort, and it will be very helpful so that we can compensate and we can make up for this current deficit that we have in our health institutions. So that would be all on my side. Thank you. Thank you, Dr. Borja. Now you will have the floor, please. Yes, it is very important in these trainings that to make the remark that all of these doctors are going to be very committed and they will be supervised at all times by specialists who will be the ones in charge of providing treatment for these 25 patients per team, as we stated. These are very committed professionals within IMSS and the other institutions. They will receive the proper training first. We're hoping to go along with the recruitment process next week and then start with the training as soon as they are recruited. And the purpose is that before we reach the most intense period of the epidemic, we will be fully prepared to deal with it. All right, now we will move on to the question section. So let's start with these three women on the front. You have asked recently and you haven't, so let's give you the floor. Thank you very much, doctor. So I would like to ask, what's the salary? What's the average salary of these specialists? And are you considering to have salary increases, to increase their salary during this 6-month period at all? That would be the first question. Can I ask a second question? Yes. And today, one of our colleagues at Milenio, he analyzed the data that you have been providing every day, and his report says that 60% of the people who have died are not senior citizens. And this contrasts the data that has been presented in Italy or in Spain, in which the percentage is only 4% or 5%. So what we're saying is that people who are dying in Mexico are not mostly senior citizens. So what does this mean? Do we need to have a change of strategy? Because you have been saying that young people don't really have severe symptoms, and we're seeing that they actually do present severe symptoms. So What can you say about that? And then you've been talking about how the comorbidity factor is hypertension. There are some studies that say that there is a drug that is prescribed for hypertense patients that could aggravate the symptoms of COVID. So, what are you doing on that regard, doctor? Thank you. It's very quick. Well, these are the data provided by the IMSS, by the National Social Security Institute. On average, a specialist like this earns somewhere over 30,000, 34,000, around 34,000 pesos a month before tax. A general doctor has a 26,000 pesos monthly, roughly. And I would like to state again that all of these benefits that we are providing and will be providing to the specialists are also part of the attractiveness of these positions. Now, part of this calling is that on top of this 6-month hiring period, they will have one payment of one month in advance of payment. So the first month will be paid in advance. We're also providing some extra compensation for specific expenses. That we are still determining of the amount of this initial compensation. For example, there are doctors that are gonna have to move from their original states or cities into the Mexico City for the training. So we will compensate those expenses. Now, about your second question, whether we are considering increasing the salaries along these 6 months, we've talked about it with other institutions to know what are they gonna do, what is their plan. Because yes, we have thought about, and we talked about with the union, about the possibility of having monthly or gradual salary increases. But we will be coming to a decision about percentage and duration, and we'll be talking about it. We'll be presenting the information in the following days. It is probable that these increases in salary will last for the whole contingency period, but we will present the information when we have the more specific information. I won't give you a percentage right now because we are still analyzing it, but you'll have it very soon. And talking about the senior citizen phenomenon as compared to younger people, it is exactly what I have just explained. Mexico has the age distribution which is younger than European countries. For example, Spain, Italy have 50% of their population are under 43 or under 38. In Mexico, the age, we have half the population. Half our population is under 27. That is the average. So that is a positive thing because we have a younger population overall. Of course, when we're talking about half the population, it means that the other half is also younger. And this is a positive aspect when it comes to coronavirus. But as you have stated, and actually I just stated it as well, we have a population with a severely deteriorated health state. The magnitude of the epidemic of diabetes and obesity in our country, and with them a set of chronic diseases like hypertension that are closely related, these have an impact on our population. And today we're facing a COVID epidemic with these prolonged effects of bad nutrition. And bad nutrition and poor nutrition is not a phenomenon that is a consequence of the individual will of people. Sometimes we attribute the conditions like obesity to the choices of each individual, and that is wrong. That is incorrect, because the important thing is what foods are available. And in Mexico, we have an oversupply of a very poor, from a nutrition point of view, very bad quality foods. Just to talk about the mortality rates, in Mexico we have 600,000 people who die every year because of these conditions that we are talking about. And this has sustained for the past 10 years. Half of these deaths are related, out of 600,000 people who die annually, half of them are related to poor nutrition. And the leading causes for death are cardiovascular disease, liver failure, etc., etc. So half of the deaths are attributed to conditions that are a product of bad nutrition. And we have important causes that are excess of sugar, excess of calories, excess of salt, and excess of fat. So this is the situation in which we are standing at the beginning of this epidemic, and of course it's something that we have to be dealing with. So we have reiterated several times, our message is not addressing exclusively senior citizens. So let's say it again. There are people who have conditions that make them more likely to have severe symptoms, complications, and eventually die. And those people are senior citizens on one side, but also people who have certain chronic diseases, such as the ones and every night we've been repeating: hypertension, diabetes, pulmonary disease, and chronic cardiac disease, heart disease, as well as kidney failure, and immunosuppression as well. The people who have HIV, for example, and have a deteriorated immunological system. But I would also like to make very clear that the isolation measures, when we say stay home, we're not saying stay home if you have these conditions. We're saying stay home. Doesn't all of you stay home, because this will have a massive effect, and as we have a decrease in the public space, daily mobility, will have a decrease in the infection rate of the disease. And about the medication, well, yes, these papers that have been published are useful scientific data, but not completely conclusive. We haven't reached a scientific consensus yet. It's been indicated that these drugs that you were talking about that are prescribed for hypertension has a substance called angiotensin, and basically because of a particular molecular and cellular dynamic, there have been some studies that suggest that the virus could have an easier access to the cells through this molecular mechanism that is facilitated by this medication. So the idea started to propagate that these hypertension drugs that modify the molecular structure of our bodies could facilitate the access of the virus. But there's still no conclusive absolute scientific evidence that would indicate that we should change the treatment of these conditions so far worldwide. We haven't reached a consensus in which we know that we have to change the way we treat hypertense patients because of these reasons. All right, let's continue. You just talked about the salaries of doctors and at IMSS. I would like to know what are the salaries within the Ministry of Health, and what are the salaries for the nurses, and how many nurses are you planning to hire, or how many nurses are needed for this epidemic? I would also like to ask if the young medical professionals are actually joining this strategy, or what has been their reaction so far? And how do you classify the cases, the mild cases that are sent home to stay in home isolation? How do you determine that? Sorry, could you repeat the last question? What do you mean? Yeah, sorry. What is the I'm sorry. What is the monitoring that is being implemented on the mild symptom cases that are not tested? That are okay. Thank you. Okay, all people, any person that presents COVID symptoms and becomes a suspect case, but is not a person with that belongs to a vulnerable group. So it's not a senior citizen, has no chronic diseases, it's not a pregnant woman. These people, it's not advisable for them to go in person to seek medical care to the medical units, because we've seen what has happened in other countries. 80% of people, young people who have no chronic disease and they are not pregnant women, they will have an auto-limiting disease advancement, and after 10 days or so they won't be exhibiting any symptoms and they won't have an effective transmission rate. So if these people avoid going to, because they will have a natural recovering process, if they avoid going to medical units, then we can avoid unnecessary contagion in waiting rooms, and we can avoid overworking or saturating our medical units. Of course, let me be very clear. All people in Mexico have a right to health. So if someone has a legitimate doubt or legitimate reasons to believe that he might or she might show severe symptoms or have complications, for example, respiratory insufficiency, and this is not being uncomfortable, this is shortness of breath. The respiratory insufficiency means that you have a lack of oxygen. You feel like you cannot breathe. So if you have this, for example, it doesn't matter if you present the vulnerable. It doesn't matter if you belong to a vulnerable group. If you present shortness of breath, then you will have to seek medical care. But most of patients, they should not go out of their homes. And in order to provide medical attention to them, that's why we have the app that we have developed and the online platforms of medical counseling. And talking about the salaries, the recruitment process, the strategy is to work together, because we understand that only working together we can have the sufficient force to make the calling to doctors that will help us in dealing with this pandemic. We have reached agreement on three fundamental factors. First of all, the first one is compensation of expenses to all the colleagues that will participate in this recruitment process. The second is a sector-based effort, so we can pay them 1 month in advance. The reason why some colleagues had doubts and uncertainty was because, and it was very legitimate, because they would start working and then they wouldn't receive any payment until after 3 months. So we want to completely obliterate this uncertainty by paying them 1 month in advance. And third one, I would say is very important, even historic, is a recognition in the national medical residence examination for the commitment they're going to be displaying when treating this pandemic. So the doctors that participate are going to have an extra points on the national medical residence examination. And talking about the salary of the nurses and of the doctors, we are analyzing and we want to establish what would be a competitive salary. I would like you to give me a 1-day window of time so I can better present the information to you tomorrow. And how many nurses would be hired in this calling, in this recruitment program? The nurse deficit is near 12,000 nurses that we need to hire and provide training for. In the whole sector. Now, of the announcement you made today, did we have any new cases of infected doctors in Monclova? And out of the other ones that were isolated, has any of them been tested positive so far? Yes, thank you for the question. And I would like to tell you that all around the world, the data about medical professionals that have been infected should alert us so we can prevent this phenomenon from happening to the utmost of our capabilities. So, for example, in Spain, the ministry talked about an important percentage of their infected patients were health sector professionals. Even in China, we had a 10% of infected cases that were medical practitioners. And in Coahuila, what has happened, that today I talked about it this morning, the early results of the investigation carried out by a team of epidemiologists that were selected by the Deputy Secretary on March the 26th, and that has been strengthening over time. They were telling us some of the early results of this investigation. So, in the case of the hospital number 11 in Piedras Negras, we detected a case of a nurse who had tested positive, and then we decided to isolate the 31 workers that had direct or indirect contact with this colleague that tested positive. And he's been at his house and he's stable. But what did we do? We implemented a sanitary process of intensive cleaning and sanitization, and we are monitoring any atypical case. Now, I would like to point out that in the Piedras Negras case, before all the way up to the contagion was confirmed, we haven't received at that hospital any COVID patients. So it wasn't a hospitalary contagion, so to speak. It was an outside contagion. And that is why we are establishing and implementing the isolation protocol for the 31 people who have been in contact with this patient. But none of them have tested positive so far or shown any symptoms. Thank you. Good evening, everyone. I would like to ask, the strategy that you are implementing, are you considering the mental health factors that are affecting the population? And the second question would be, there are some testimonies of people that say that one of the symptoms is diarrhea. Some of the symptoms are diarrhea and the loss of sense of smell. And also, could you talk about the protocols implemented at the airport? Okay, talking about the airport first, the 5 airports in which we have the highest amount of mobility and flights with the United States. From last Saturday, we decided to implement a new filtering process, and the DN3 force is auxiliary. It's playing an auxiliary role in this. So the Navy is supporting our labor in the implementation of this, and the Army is helping us in the implementation of this protocol in the airports, because we want to insist that we're about to start what formerly was the holiday period, and we are not having holiday. And let me emphasize this: we are not having vacation period this year. But of course, a lot of our fellow Mexicans who are living abroad or are in the States might be prone to coming back to Mexico. So we really want to provide the adequate help and orientation to all these people before they reach their family, before they reach their home. So maybe you noticed that we started implementing this new protocol at airports since last week. And talking about mental health, we've had 2 sessions at least of these daily conferences in which we have had the presence of the National Mental Health Institute director, and she will come back next week, we hope. We've also had the intervention of Dr. Juan Manuel Quijada and our colleagues in the National Commission Against Addiction. And we will be bringing them precisely so they can provide more in-depth information to you regarding the possible mental health implication of dealing with this pandemic. So it's a topic that we will continue to explore in following press conferences. And talking about the accessory symptoms that you were referring to, and we were talking about this something similar when we were talking about face masks yesterday. Please do not forget that sometimes the influence that a small piece of news, or that is not necessarily based on evidence, sometimes a small piece of news or information has a chain reaction and has a wild distribution in media, social media, and national media, and it's not necessarily scientific information. It's not necessarily something that is backed by science or by evidence. So we've had that. For example, we have a similar thing with a drug that was supposed to be miraculous and was really good against COVID and became very popular, the piece of information, but it wasn't backed by any scientific evidence. So it's the same with the accessory symptoms as impairment of sense of smell. It's possible that it could present in some cases, but there is a medical reason for it, but it shouldn't be. It's quite irrelevant piece of information. Okay, we have 5 minutes to go. Thank you very much. Good evening. And doctor, could you remind us what are the numbers? What are the goal in when hiring doctors and nurses? Could you tell us once again in this national recruitment strategy? Do you have a set time frame? And if you didn't reach the goals within the time frame that you set for yourselves, what would happen then? Also, I would like to know how many resources, financial resources, are going to be allocated to this strategy, and how are you going to be providing security and safety to these doctors, taking into account the situation that we have in some regions of the country. Yes, today we are launching the national program of recruitment for our nurses, our doctors. Tomorrow we will begin the registration process, and the selection process will begin as well. April the 6th we will begin hiring formally. April the 6th we have to have started by sector the hiring process, and 7th to 9th of April we want to hire 20 to 25% of the deficit we are seeking to fill out. And between the 10th and the 13th of April we will have hired 40 to 50% of our human resources. 14 to 17 of April, 60 to 75%, and 18 to 20th of April, we will have hired 90 to 100% of our human resources for dealing with COVID. Those are the goals and those are the time frames, and that's why we are launching this national recruitment program. We ask for your help in spreading this information, because we need the help of our specialized doctors, but also our general doctors and our general nurses, that so they can help us. So they can help us with the distribution of medical care, so the specialists can reach the patients that need them. The total goal of doctors is 6,600, and nurses 12,600 or so. And what happens if the recruitment program is not successful? Well, as you know, we're talking on two fronts. We're acting on two fronts. One of them is we are recruiting, but also the existing human resources that we already have, is being also optimized. It's being also we're following a waterfall model or a cascade model that means our top-notch specialists are providing training for our less specialized doctors, and then those to the less specialized doctors, and then we have optimized the overall level of all of our human resources in order to deal with this pandemic. We don't have enough time. I think that last question will have to wait for tomorrow. I would like to remind you that we are still on the national program of healthy distance. It started on the 23rd of March. It intensified on the 30th of March, and it will last until April the 30th. So we are not on holiday. We are not on vacation. Stay home. The goal is that we all stay home to the best of our capabilities. Let's not go out. And we will have a positive effect in mitigating this pandemic. When we eventually reach phase 3, that will happen, then we will have a much better capacity to respond and provide care to COVID patients. So stay home, stay home, stay home. Thank you very much.